To excellence in heart care, only from the most experienced in our region.
Yeah, UC Health has been improving and delivering heart care for 200 years in Cincinnati by translating the latest science into treatments for you and your situation.
Now today we're learning more about UC Health's heart care program. Take a look.
UC Health has been providing excellent care, research, and education for the last 200 years. We also have the first heart transplant program in the region that has been going on for 35 years. And based on our patient outcomes, we are in the top 10 percentile of the nation. UC Health partners with University of Cincinnati, with College of Medicine. In the academic tertiary healthcare system, we have access to the latest research, education, as well as compassionate clinical care. UC Health is the region's only Level 1 trauma center, where patients who may present to our emergency rooms include those who may have trauma. In addition to that, may have an underlying acute cardiac emergency, such as cardiac arrest, or a heart attack, such as acute myocardial infarction. As they are being resuscitated and actively supported, their survival is dismal or poor without some sort of artificial heart-lung support. When these patients present to us via ambulance to the emergency room, immediately a multidisciplinary team effort is put in place, is between cardiothoracic surgery, interventional cardiology, emergency room physicians, and at times trauma physicians. We also have various other clinical cardiovascular programs such as eCPR, ECMO, advanced shock and cardiac arrest programs that are unique to the region and provide the most complex care for our patients. eCPR is a unique program. There are only few programs across the country that participate in this level of care with a lot of resources devoted. There are active research and studies going on the survival, and we have a great survival rate in our program despite the most complex and sickest patients we take care of. ECMO, or ECMO, stands for extracorporeal membrane oxygenation. It's essentially an artificial machine that supports the heart and lung while the patient's own organs cannot sustain that function. It essentially involves two tubes where the bad blood is taken out of the body and it's oxygenated in a machine. The carbon dioxide is removed, and then the clean blood is given back to the patient, and ultimately the patient's organs are rested with the support of this machine. Most patients recover and are taken off the support in a certain number of days. Those patients, especially with the heart care, if their heart function does not recover, some bridge over towards artificial heart support or a cardiac transplant. These patients require a multidisciplinary collaborative team effort, and UC Health is able to provide that care to these most complex patients in a timely fashion. We train the next generation of cardiologists in my specialty and all the other specialties that go out and practice medicine in the area and across the country.
Excellence in heart care, only from the most experienced in the region. Learn more about UC Health's heart care program at uchealth.com/heart.